What are the potential complications of eyelid surgery?
Cosmetic upper eyelid surgery, also known as upper eyelid blepharoplasty, is consistently ranked amongst the most popular cosmetic procedures. Many of my patients have come in motivated to have eyelid surgery because they realize that their eyes are the most visible part of their face when wearing face masks. I also hear a lot of my patients saying that they end up looking at themselves for extended periods of time during Zoom meetings, and they realize how tired they look. The aesthetic field has been experiencing a Zoom boom, and many of my friends and colleagues are busier than they've ever been. Unfortunately, the rise in popularity of any procedure generally coincides with a rise in complications associated with that procedure. Eyelid surgery is unique in that complications can not only have cosmetic consequences, but complications can also affect vision and eye function. I'll discuss my perspective on complications associated with upper eyelid surgery and how I manage these issues when patients are referred to me. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I specialize in a range of cosmetic eyelid procedures, such as treating hooded upper eyelids, under-eye bags, as well as eyelid ptosis correction, eyelid retraction repair, and lacrimal gland prolapse. I also specialize in helping people who've experienced complications from eyelid surgery, such as lower eyelid retraction. Upper eyelid blepharoplasty is typically performed to address upper eyelid skin hooding and fat prolapse. This procedure can really help your eyes look brighter. As far as upper eyelid surgery complications are concerned, I see patients who come in with one or more of the following concerns typically. 1, the upper eyelid looks hollow. 2, the upper eyelid crease is too high, too low, or doesn't look the way they'd like. 3, upper eyelids are drooping. 4, upper eyelids are difficult to close. Let's start with hollow eyes. Upper eyelid hooding and redundant skin and fat can often obscure the appearance of bone volume loss that results in a widening of the eye socket. In this situation, the patient may simply need to recognize that aging is not limited to just laxity of the soft tissue around the eyes, but also that it affects the bone structure. I often see this situation and address this problem with the placement of hyaluronic acid fillers in order to add volume and restore fullness that the patient finds desirable. As far as concerns about the eyelid crease placement, there are times when the outward extent of the eyelid crease may be objectionable to the patient. Fortunately, the skin in this area can be relatively forgiving, and issues related to the eyelid crease are generally self-limited. A strategy that we use in our practice to avoid any miscommunication is that we have our patient review the markings that I make before they come into the operating room so they know what to expect afterwards. Still looking tired after cosmetic upper eyelid surgery is often due to the operating surgeon not addressing the patient having had upper eyelid ptosis. This is very common, as most surgeons who perform blepharoplasty are not familiar with or comfortable with performing ptosis surgery. This can be frustrating for patients who expected their eyes to appear brighter after surgery. When I see these patients, I perform upper eyelid ptosis surgery to help them look more awake and more vibrant. One of the most difficult problems to manage is when too much skin is removed from the upper eyelids. This can result in difficulty with lubricating the surface of the eyes, since the upper eyelid behaves like a windshield wiper to distribute tears over the surface of the eye. Oftentimes, the same patient will have difficulty keeping their eyes closed while sleeping, which consequently results in exposure of the eye. When the eye is not properly lubricated, the surface of the eye, and in particular the cornea, can become scratched and even infected. These patients typically need aggressive lubrication and protection of the cornea, particularly while sleeping. Many times I've seen the same patient having difficulty with eye protection because not only do they have skin shortage in the upper eyelids, but they also have retracted lower eyelids. If there is a skin shortage with compromise of the eye, then skin grafting procedures may be necessary. Throughout my career, I have always preached that eyelids that look good function well. Recognizing that eyelid function for ocular protection and optimal vision needs to be considered when planning cosmetic eyelid surgery and thereby help minimize the risk of complications. I hope you found this information helpful. Thank you for your question.